This survey, conducted by Performance Monitoring for Action, a consortium that generates reports monitoring key health indicators in 9 countries in Africa and Asia, indicates that public and private hospitals in the country continued to experience stockouts. Majority of hospitals, 70%, said they ordered the commodities but did not receive, which could be explained by an interruption in the supply chain.
We see that over time, since 2014, the use of family planning has increased from about 56 to about 61%. This is important because this is in line with what the government committed itself to do, to increase access and the number of women being able to access and use family planning.
This survey sheds light into family planning choices and marital status of women. Married women are seen to use modern contraceptives more than their counterparts, 58% in 2019 and 62% in 2020, are compared to 56 and 61% in that every period for the later group.
Short-acting methods are decreasing in terms of usage, and more women are using long-acting, reversible or permanent methods. And that difference is important because the long-acting are much more effective, so they are more protective for a period of time.
The government, amidst COVID-19, put in measures that ensured continuity of sexual and reproductive health service provision.
In terms of the services at the service delivery point, we are not seeing much of a change. Indeed, very few facilities were closed. Very few facilities were not having service providers to provide services. So again, need to commend what the government did, because by putting guidelines on how services could be maintained during the era of COVID-19 has helped to ensure that facilities were not closed down.
This study comes out even as health and development players raised concerns about the rise in unplanned pregnancies due to the lockdowns, curfews and disrupted health services caused by the pandemic.
Unintended pregnancy can lead to many things. We know pregnancy-related child death, death of the mother, events like that. So anytime you reduce the number of pregnancies, you protect the woman. And family planning contributes to that process because it ensures the women do not get pregnant, and without pregnancy, pregnancy-related complications are reduced.
Organizations such as the International Rescue Committee reported that the number of teenage pregnancies increased dramatically in regions of northern Kenya as a result of school closure and lockdowns in 2020. Robi Omondi, K24 Evening Edition.